Good afternoon, everyone, and thank you for joining. We're going to let everyone continue to log on and get started in just a couple of minutes. All right, it is 12:02, so we'll go ahead and get started. Hi, everyone. Thank you for joining today's webinar, SOC Reports. What are they and what are the benefits for a healthcare organization? Today's program will be presented by Scott Mahoney, Principal in Withum's Healthcare Services and Systems Process and Assurance Team. Before we begin, I have a few notes. Today's materials can be found in the toolbar on the right of your screen and will be distributed to you after the program. Also, at the bottom of the toolbar, you will see a questions box. Feel free to send us your questions during the presentation. We will do our best to address them at the end. There will be 4 polling questions throughout the program. To qualify for CPE credit, you must participate in each poll. CPE certificates will be emailed to you within a few weeks. And finally, once the webinar is over, there will be a pop-up asking you to complete a survey of today's webinar. Please take a moment to complete it. It is our way of being able to provide you with the best and most relevant programs possible. I will now turn it over to Scott.
Rachel, thank you. And thank you everybody for your time today. I know time is very valuable, so hopefully I will use your time wisely today. If you do have any questions, please do feel free to send them and I will address them ideally by the end of the program. I do have a pretty full plate to go through, but again, I'll try to leave time for questions. Otherwise, I'll address questions after the presentation. So SOC reports, what are they? What are the benefits for a healthcare organization? It's a key question. SOC reporting, just from a very high level, they're reports based on internal controls and evaluating internal controls. So during this presentation, I'll try to go into the specifics. Why would an organization go for them? Is it worth the investment and the time? So hopefully you'll have all those answers by the end. As Rachel said, my name is Scott Mahoney. I am a principal at Withum. I've been with Withum a little bit over 6 years. I am part of our healthcare niche, as well as in our systems and process assurance group, which specifically looks at internal controls and evaluates organizations and the controls that they've established within their different areas within the organization to determine where there may be risks that aren't addressed and how organizations can better protect themselves and make sure that they're addressing legal and regulatory requirements in the process. Our learning objectives for today is, one, we'll be looking to define what is system and organization control reporting. So a little bit of background on it. So you understand the genesis, where it comes from. It is not a new concept, so we'll go through that. Identify the different types of SOC reports. So there are multiple types of reports, and we'll identify some use cases. Just based on time and significance, what I'll try to do is focus on really what's important and what a healthcare organization or business associate may want to concentrate or focus on as far as their SOC reporting needs. So I'll focus on those types. Also, I'll work to identify how SOC reports can aid an organization in meeting their regulatory requirements. So they are a big means of allowing an organization to meet those regulatory requirements and really demonstrate that they've gone through and performed due diligence on the organization, which is key in the event that they would ever have any type of assessment from whether it be based on HIPAA or HITECH regulations or any other type of area, which could be the result of a breach or just a regular assessment. The agenda. So how are we going to accomplish and meet those objectives? Well, one, I'll go over the SOC history and the reporting options. I'll go over SOC for service organizations and what that means. As I mentioned, I'm going to try to drill in more specifically to the relevant SOC reporting options, and realistically for healthcare organizations, SOC 2 and SOC 3, as well as HIPAA and HITECH attestations are really the focus that healthcare organizations should be focused on. So let's go into SOC history and reporting options. As I mentioned, there is quite a bit of history when it comes to SOC reporting. So the actual name of SOC reporting as it's used just came about in 2011, as you can see in this illustration. However, it really started all the way back in 1974 with SAS3. I'm not going to go through each and every event that occurred that helped the evolution of SOC reporting and where it came today. But ultimately, there was a big push with SSA 16. In fact, a lot of people were referring to SOC reports as SSA 16 reports for a while during the initial change. However, over the last, really 2011 is when the new regulations came out and guidance that started the evolution of SOC as we know it today. Ultimately, SOC reports, they're focused on internal controls, how an organization is operating, performing controls, and depending on what is being performed by the organization, that really drives the scope of what is included within a SOC report. So it is used in a lot of different industries, healthcare being one of them. And it's also used as a valuable tool when it comes to regulatory due diligence to identify that you've performed your due diligence. So one other thing of note here is you'll see 2017, SOC for cybersecurity came about. Again, it just continues to evolve. So you'll see there's SOC 1, SOC 2, SOC 3. Then in 2017, SOC for cybersecurity. And actually, as we continue down the path after 2017, during the evolution of the SOC reporting, they actually decided to rename what SOC was. So it's currently named Service Organization Controls, or it was prior to 2017. The reason why is the reports were actually really intended at that time for organizations that were providing a service to other companies. So for instance, the ADPs of the world, in the fact that they're providing payroll services, just as an easy example. So they're providing payroll services to their client organizations. Well, the AICPA in 2017, they actually wanted to rebrand that during the whole process of bringing in SOC for cybersecurity. Instead, they renamed it to System and Organization Controls. The reason why they did that is because they wanted it to be for organizations not just providing a service to others, but also as a means for any organization that has requirements that need to be met. It provides a framework for those requirements to be evaluated. So with that, you'll see under the rebranding, they do have SOC for service organizations, which we'll go into a little bit further. And then they also have SOC for cybersecurity, which came out in 2017. And they came out with one more, SOC for supply chain. So in this discussion, I will focus much more on those elements that are related for a healthcare organization. So I will focus more on the SOC 2, SOC 3, as well as specifically HIPAA and HITECH attestations. SOC brand. So SOC brand is system and organization controls. You'll see here that just an overview of those key elements that I pointed out previously. SOC 1 is really intended for organizations that are providing internal controls over financial reporting. So this is, as a good example, I'll go back to ADP. I always use that because most people, it's a very well-known service provider, one of the largest providers in the world, and most people do get paid through ADP or an organization like that, so it's an easy example to go with. So using that example, ADP has a number of SOC 1 reports based on the different payroll services that they offer. And the reason they use SOC 1 for that is because the report is evaluating their internal controls over financial reporting. So because ultimately what they're doing is performing a function that hits their direct clients' financial reports, that's why those controls are focused within the SOC 1 framework. So as I mentioned, when it comes to healthcare, usually that's not the type of report that you would see. It would be more focused on the SOC 2 and SOC 3, and I'll go through that in a little bit further detail. So the SOC 2 and the SOC 3, they're all based on what's called trust services criteria. This is defined criteria that the AICPA has put together, so that way, when you are looking at one report that is for one organization, it's actually you're able to compare it apples to apples with another organization that is doing a SOC 2 report. Now, the controls may be different. However, the criteria that has to be met is the same. So that allows organizations to really make sure that they're meeting the common standards. So very similar to HIPAA and HITECH, there are standard criteria that have to be met. So under that same guidance, there are trust services criteria. Now, one of the key elements here when it comes to healthcare, and we'll talk a little bit more, actually quite a bit more about it, you'll see there's a bullet here for SOC 2 plus. When it comes to healthcare organizations, this is really critical because this allows, or the ultimate framework that the AICPA has put together, this reporting framework, allows organizations to bring in other types of guidance and requirements within the SOC 2 framework. So that way, not only can you meet the trust services criteria, but you can also address HIPAA and HITECH within the same report. So you're able to have an independent service auditor come in, evaluate the controls, and provide an opinion on whether you have controls that are meeting not only the trust services criteria, but also whatever regulatory requirements you may be required to meet, such as a SOC 2 plus HIPAA or HITECH. And ultimately, there's about 80% overlap of the control coverage between the trust services criteria and what you'd need to cover on a HITECH or HITECH or HIPAA assessment. The last one you'll see here is a SOC 3. SOC 3, ultimately, it is a SOC 2, except it has a different distribution. It is much more pared down report. I'll go into that a little bit further. You'll see here at the very end of the day, what do you get after you obtain a SOC report? One, you obtain a report that includes the auditor's opinion, whether we as the auditors believe your controls were reasonable and established to meet the framework. Additionally, you also have access to the AICPA official logo. This logo actually came out with the initiation of the SOC reporting, because prior to that, there was SAS 70s that some of you who are a little bit older may have heard about. And with SAS 70s, a lot of organizations were just putting logos saying SAS 70 certified and making these logos ad hoc and putting them on their website. Well, the AICPA wanted to go away with that and have an official seal. So they did that. So with every report that is issued, you have access to obtain the official SOC logo from the AICPA. Then they also have SOC for cybersecurity, and now they also have SOC for supply chain as well. Again, I'm not going to get into those in very much detail. So with that, we'll go to polling question number 1.
Thank you, Scott. Our first polling question: what brings you to the SOC training today? I'll leave this up for about a minute. Reminder, you must answer each poll to get CPE credit.
Make sure to get your votes in.
About 30 more seconds.
Almost there. Up to 90% voted. A few of you get your votes in while you can.
All right, I'm going to go ahead and close it out. And here are the results real quick. So looks like 61% are trying to get up to date on my CPE.
Sounds great. And it's a great way to use your time. So whether you're eating lunch now or not, I don't take offense. So the main thing is, as long as you're listening and trying to understand exactly what these are, how you can benefit, even if your organization themselves does not go through this process, it's always beneficial from a vendor management perspective. And I'll definitely talk about that quite a bit as we go through more slides, how beneficial this is from the standpoint of managing vendors. Okay, so now I'll go over the overview of SOC for service organizations. So what are some of the key considerations in determining if there is a need for a SOC for service organization report? Well, one determination is the type of service being provided. For instance, if your organization has information storage or retrieval services, or if your organization has transactions or information processing, especially from a healthcare perspective, there are requirements on maintaining the security of that information. Is that data being encrypted? How is that data protected? How is that data being transmitted? So all of that is critical in understanding as part of the consideration of whether you should be getting a SOC report. Also, is your organization a SaaS organization? So are you providing a service to other organizations online? If that's the case, you're going to have customers that are looking to ensure that their data is protected. And how is that being protected? Not only that, but they're looking to see that their risk is mitigated. So I just mentioned about, from a vendor management perspective, maintaining and evaluating those vendors that you work with. Well, this is critical. It's also viewed as a element that really is not only a competitive advantage, but almost a competitive requirement nowadays, where in order to compete in the market, these customers want to see that you're protecting them, the data, and any information. So what's another consideration? Well, another consideration is a requirement. So a number of organizations, they're actually contractually required to obtain a SOC report on a regular basis. So it could be required by a vendor management program. It could be required through your bank. They want to make sure that their financial investment is being protected and your organization isn't going to go under. So they have requirements themselves that their customers or the organizations they invest in have those controls established. What's another consideration? Well, another one is competition. So this very well could be a competitive advantage, or as I said, it may be required by those organizations that you're trying to win over. So we do find quite a bit that in order for organizations to reply to an RFP, request for proposal, they're required to have some type of report. All of a sudden we have these organizations reaching out to us, how can we get a report in our hands immediately and be able to actually respond to this RFP? Well, unfortunately, it is a little bit of a lengthy process, so it's not something that can happen overnight, but there is some foresight that is required to go through the process. Another consideration here, and the last one that I've outlined, is compliance. So this could be a means of defining the fact that your organization has taken appropriate steps to protect the organization. Can you automatically say that you have 100% controls in place to protect yourself from a breach from happening, from data being exposed to someone? No, you never will, no matter how many controls you establish. But this allows you to demonstrate to anyone that may come in, if there was a breach, to show the fact that you did take steps to try to manage your risk and mitigate the chances of anything going wrong. So that's really critical as part of your due diligence process and your ability to maintain compliance with standards, laws, and regulations, is have something to demonstrate the fact that you've taken steps. And not only that, with SOC reporting, it demonstrates the fact that you have been independently assessed to evaluate how well your controls are. So question, if my service is in a hosted environment, why do I need to get a SOC? So we have a lot of customers of very large organizations, let's say AWS or Microsoft Azure, and they'll say to us, well, Microsoft Azure and AWS, they have SOC reports themselves. Why do I need to get one? Well, in the image here, it's kind of like a sandwich. So the AWS or Azure may be the bottom layer of that sandwich, and you may be in the middle of that sandwich. But ultimately, you're providing the foundation may be through AWS, but you're maintaining all of the good stuff in the middle. So you're managing ultimately who has access within the application. A lot of times you're managing a lot of other elements that go into play, change management process, and there could be coding involved. So there's a lot of other elements that your cloud service provider or your sub-service provider isn't actually managing. So this allows you to focus and evaluate the controls that you're responsible for and demonstrate the fact that those steps have been taken. So a SOC report for AWS or a data center provider, in short, is not sufficient. You would need to get one yourself. Types of SOC reports. So we did talk a little bit about this. As you'll see here, we do have basically the outline. Again, I didn't go through SOC for cybersecurity, SOC for supply chain, but I do want to focus a little bit more on SOC 2 and SOC 3, which is really critical. So working down this path, looking at SOC 2. Before that, let's actually jump into polling question number 2.
Okay, our second polling question, what does SOC currently stand for?
Make sure to get your responses in.
Leave it up for about 30 more seconds.
Well, it's a pretty close race here between 2 answers.
All right, I'm going to go ahead and close it out. And here are the results.
So it was a very close race here. 56% said system and organization controls, while 43% said service organization controls. So it used to be service organization controls. When they rebranded it, it became system and organization controls because it's much more broader than just looking at service organizations. All right, so looking a little bit more into SOC 2. This is intended to provide customers and prospective customers with information about the service organization and how they're handling their data information. Within that, there's a number of tiers that ultimately are part of the pyramid. So as I mentioned before, not only is there a SOC 2, but there's a SOC 2 Plus. So these engagements really start working off the trust services criteria, which does have multiple layers. The base layer, which is also called the common criteria. So that means any report, any SOC 2 report has to cover a minimum of security. So that is looking at elements such as access requirements. It's looking at who has access to data, who has the ability to make changes to data. It also looks at the fundamentals of an organization from a entity level control standpoint. So does the organization have a means in place of evaluating the risks that the organization is really up against, and regularly evaluating the controls that have been established to meet those risks. So everything from that very high level all the way to the specifics of what the organization is doing to secure the data and information that's within the scope being assessed. From there, you actually have a different options as far as what you're covering. So they also include confidentiality, availability, processing integrity, and the last one is privacy. So depending on the scope, and ultimately the scope is chosen by the organization on how in depth they want the assessment to go. With each of these, there are different criteria to be met. Going into security, as I mentioned, it is the common criteria. What this covers is it evaluates if information and systems are protected against unauthorized access. Also, unauthorized disclosure of information and damage to systems that could compromise the overall integrity, privacy of the systems that affect the entity's ability to meet its objectives. So ultimately, as I mentioned, beyond those, it does include the base criteria, which are the entity level controls. So when I spoke before about establishing the foundation of a SOC 2 report and making sure that you can compare apples to apples, well, that's why they've established security as a common criteria. So they're making sure any SOC 2 report has to cover security and these base criteria, so that way you can have that apple-to-apple comparison when you're looking at multiple reports. Yes, there could be other criteria to be covered, but at a minimum, they want to make sure that security is covered. Confidentiality, what this covers is information designated as confidential to protect, is that information protected? So above is information secure. This is talking about, and going to a more granular level, is how does an organization know what information is classified as? Do they have any type of means to identify what information may be specially classified? And if there is, what is done to protect that beyond other protections that are just provided for any employee? So is there a ranking of classifications on data? Is there special handling on confidential data? And that's really what this gets into. Confidentiality is distinguished from privacy. As I mentioned before, there is a separate privacy category that's covered. What differentiates the two is privacy applies only to personal information. So when we talk about protected health information, so PHI or PII, personally identifiable information, that really is what would fall under the privacy category, as opposed to confidentiality, covers more confidential data that the organization may hold, such as financial information, or there may be key data on schematics that the organization is trying to maintain, or engineering data, things like that. And that's really what confidentiality is geared toward. Availability. So what availability covers is, how does an organization make sure that their information is available for use to meet the entity's objectives? Now, this is more appropriate when you do have, let's say, an AWS or some type of SaaS, so system provided over the internet. For instance, let's go with ADP, for example. People need to make sure ADP is available to process payroll in a timely manner. So ultimately, they would need to make sure that they're addressing the availability concerns that their clients have, and this is one way that they would do it. So those criteria would be identified and covered within the availability category. So availability refers to accessibility of information. Is that information accessible? And is the system able to be used the way it's intended in a timely manner? Moving on to processing integrity. So system processing is complete, valid, accurate, and timely, and authorized to meet the entity's objectives. So processing integrity is really getting to the point where organizations that are doing a lot of data processing, that have requirements for data processing, what types of controls are in place to validate the data, make sure that the data, try to avoid dummy data being brought in, make sure that there's validity checks and data accuracy checks within that data to make sure that processing integrity is able to be met, and they're able to ensure that on a reasonable basis, the data that they have within their system is what it is intended to be. So again, you're not likely to get 100% integrity of data. However, it's trying to minimize the potential for error. So processing integrity addresses whether systems achieve the aim or purpose for which they exist, and whether they perform their intended functions in an unimpaired manner, free from error, delay, or omission, and unauthorized or advertent manipulation, which I think that's another key element there, is from a processing perspective, how do you limit another individual, an unauthorized individual, from accessing data? So the more automated controls in place, the less ability for somebody to go in there and actually edit the data themselves, that obviously is one of the things that you look for when you look at processing integrity. So let's look at the last criteria here that's available within a SOC 2. So the last one is privacy. And what this covers is, and I know we talked a little bit about this when we talked about confidentiality, is this goes into personal information. And more specifically, how is that information collected, used, retained, disclosed, and disposed to meet the entity's objectives? So especially when you're dealing with elements such as HITECH and HIPAA, this is a crucial element in really ensuring that you have a means to identify the personal information you have, maintain an inventory of it, and identify how that information is to be used. And I know with a lot of privacy laws that are coming out, there's also additional laws that require access and the ability to remove that information in a timely manner as well. So the trust services criteria that was established in 2017, this just depicts the fact that there are a number of criteria that have been established. So as we just went through the different categories that are available, you'll see here that for security, the common criteria, there is the most number of criteria, again, because it's establishing that baseline. There are 33 criteria to be addressed. Confidentiality has 2, availability has 3, processing integrity 5, and then privacy is a pretty decent lift in itself just because of the content that it's covered, has an additional 18 criteria. You'll also see something over there on the right, which is the points of focus. The points of focus are really additional elements that the ASCPA put out there, really just as guidance on what types of controls can be used to address the criteria. One of the misconceptions as people were first learning how to perform these assessments is they thought that a control was needed for each point of focus, and that's definitely not the case. So it's good to make note of what the points of focus are, again, as guidance, but nothing more than that. So again, they shouldn't be considered as a rule of thumb to follow when you consider the number of controls that you have. For types of SOC 2 reports, there are multiple types. Actually, there are 2 different types. One covers a point in time. So for instance, if I was assessing of controls at an organization, I may be assessing them as of today, 4/20. And what I would be looking at as an auditor would be the design of controls only. So the opinion is only on the design of controls. And you'll see on the seesaw at the bottom for level of assurance, for there, you actually have a much lower level of insurance than you do with a type 2. So a lot of contracts will require a type 2 report because of that, because you do have greater level of insurance with a type 2. Now, what a type 2 is you're covering both the design and operating effectiveness of controls. So what that means is not only would we be looking at have the controls been designed and have they been put in place, but we're also looking at how have the controls operated over a period of time. So as an example, if one of the controls is the fact that anyone who receives access to the systems, which is a critical control that you need to have when you're talking about protecting data, how is that access managed to ensure that only appropriate individuals have access? So in that example, we would look over a period of time, were those individuals approved to have access before they actually got it? And usually for a type 2 report, there's actually guidance suggests reports shouldn't be less than 6 months. There are instances where they are less than 6 months. Ultimately, what we always try to do is get clients to get to a point where they're performing these assessments on an annual basis. A lot of that is driven by contractual requirements. Some customers actually have a report issued every 6 months, and that's just because their clients have different contractual requirements. So they do need reports issued twice a year. So as far as coverage is concerned, it does cover a period of time, and that period of time is evaluated as part of the control assessment. All right, with that being said, let's move to polling question number 3.
On to our third polling question. Which of the below is one of the 5 trust services criteria categories?
All right, we only have a couple votes in. Get your votes in.
Leave it up for about 30 more seconds. All right, I'm going to go ahead and close it out. And here are the results.
All right, so 57% said security. Those 57%, give yourselves a small pat on the back. That is correct. So that if you recall, the categories that could be selected start with security as the common criteria. There is privacy, processing integrity, availability, and confidentiality. So when is a SOC 2 a good fit? Here are questions that you can ask in trying to determine that. So are your customers, risk and vendor teams concerned about data security, availability, confidentiality, or privacy? A lot of times we do have clients come to us and say they're getting these security questionnaires all the time. They want to reduce the amount of work that they have to put in on those one-off security questionnaires. So this is one way that a lot of organizations go and do that, is they actually not only are able to address all of the same questions that would come up in those security questionnaires, but not only that, they're having an independent assessment of those controls that are defined in those same questionnaires. Next is the integrity of transactions processed by the system critical for customers. So do you have customers that are really unsure and they want assurance the fact that the controls that are being performed are allowing their transactions to be processed in a means that they can trust the data?
So I was going to stop right there. I don't think we can see your screen. You may have to reshare.
Sorry about that. Let me try again.
Perfect.
Okay. Thank you for that, Rachel. So I mentioned getting too many security questionnaires. That's a big driver for many organizations that may have multiple people who spend all of their time doing that. Also, I had mentioned this before, but a lot of times it is required in customer contracts, or as I mentioned before, it could also be required by a financial backer or even your banker. Lastly, is it needed to address regulatory requirements? So as we talk about HIPAA and HITECH, it may not be to provide to your regulatory body at any time, but it's more having it available in the event that you are ever assessed and there ever does become a breach. You can have that as support that you've performed due diligence, you've evaluated your control structure, really to kick the tires and make sure that you're taking steps to protect your customers' data. Who has access to the reports? Well, SOC 2 reports are restricted use documents. So those are restricted to user organizations, which is really customers, also independent auditors of those organizations. So your customer auditors, practitioners providing service to the user organizations, regulators, and also prospective users. So any prospective customers. The question becomes, how do you tell the rest of the world? Well, they do have the SOC logo, but ultimately what the AICPA did is they said, well, there does need to be a way to communicate to the rest of the world without directly having to reach out to that supplier or that vendor who obtained the SOC report. Because what about organizations just want to put it on their website and say, hey, look at what I have. So that's where the SOC 3 comes in. SOC 3 can only be prepared if a SOC 2 audit has been done. So ultimately, a SOC 3 is an add-on to a SOC 2. It is designed to meet the needs of users who need assurance about the trust services criteria, but they don't have a need for the actual full report. So what this means is, let's say that you have you don't know who your prospective customers are, but you want to show customers that you've performed your due diligence, you've taken steps to evaluate your controls, and you don't want the whole world to know what your controls are. Well, that's where this report came about. It is a much more pared down report than the SOC 2. It does not include the specific information about the controls of an organization. It just gives an overview of the service and what was covered in the report. And this report actually can be shared on your website, which you would not be able to do that with a SOC 2, and you'd also create a security risk with the information that you're putting out there about all of your controls and potential issues with controls as well. So it is a general use report that can be freely distributed. And excuse me, as I mentioned, you can also include that on your website directly as well. So what are the benefits of SOC reports for a healthcare organization? Well, it helps to ensure that an organization has implemented robust security controls that are really established to protect your patient data, as well as prevent a voluntary or involuntary breach of data. It also provides a mean to enhance customers' trust. You're demonstrating the fact that you've not only assessed your controls, but you're providing them a report that demonstrates what your controls are and what the results of that assessment were. So it's being more transparent to your customers. Are you able to evaluate, also you're able to evaluate the design or operation of your controls. So depending on if you're doing a type 1 or type 2 report. So as I mentioned, a type 1, you're just looking at the design of the controls. A type 2, you're looking at the design and operation of those controls. So it's allowing you to assess those controls. But on the other hand, from a vendor standpoint, it's obtaining that as an organization, it's allowing you to evaluate your vendors. So for anyone that you're relying on protecting your information, you're liable for that information. So you're not, by giving them part of your service or contracting another organization, you're not free of that risk. The risk still applies to you since it's actually your data. So you still want to perform steps as an organization, and all of your vendors really should have some type of report, such as a SOC report, really to demonstrate that they're protecting your data. Otherwise, you could be held liable. So it also allows you to identify deficiencies and control failures. So hopefully those can be fixed before those are actually exploited. And also the vendor has, it gives you an idea if the vendor has had any process changes or breaches or incidents that need to be disclosed. So those have to be disclosed as part of the report. Now, some organizations are providing those security questionnaires to their third parties, which is great. And that's something that in lieu of having a SOC report should be done. So this is a way where you're collecting that information. You're able to identify any of those key information without just trying to hope that it pops up on the internet at some point and surprises you that whether they had a breach or not. Also, it provides a competitive advantage, as I mentioned, because some organizations aren't going down this path. So the last piece that I want to touch upon, and I know we're getting down on time, is HIPAA and HITECH. So this is very important. As I mentioned, HIPAA and HITECH can be included within a SOC report, or you can do a separate attestation covering HIPAA and HITECH. So it's derived from the Health Insurance Portability and Accountability Act, HIPAA. It is meant to evaluate an organization's compliance against the HIPAA security, privacy, and or breach rules. It can be completed for any type of covered entity or business associate. So why get a HIPAA HITECH attestation? Well, really there's two main reasons. One is to enhance your existing control structure. So identify where you may have a gap in meeting those requirements, and also as a preventative measure. So you're evaluating those controls that you have established, and this is a way to really identify if those controls are operating the way that they're intended to. HIPAA violations. So this is one of the drivers as well. That I think is really critical in understanding a driver for going down that way. So what's key here is the fact that there are separate tiers depending on the type of finding that is identified. So for instance, if you look under the green tier, for an organization that is unaware of the HIPAA violation and by exercising reasonable due diligence, they would not have known the rules that had been violated. Under tier 2, if an organization had reasonable cause that the covered entity knew about or should have known about the violation by exercising reasonable due diligence. So as you can see, depending on the tier, the maximum penalty goes up. For tier 3, willful neglect of HIPAA rules with the violation corrected within 30 days of discovery. And tier 4, willful neglect of HIPAA rules and no effort made to correct the violation within 30 days of discovery. So if you have one penalty within that violation category, you'll see a maximum penalty of 1.5 million per year. And there are multiple categories that you could be penalized for. And here's just a sample of some of those categories. So I won't go through them all, just in the interest of time, but improper disposal of health information. If there's a failure to manage risks to the confidentiality, integrity, and availability of information. So all of these really, if you see here, if you were to have a finding in any one of these areas, they could be $1.5 million each. Very costly. And if any of you are familiar with the HIPAA, or excuse me, the Anthem breach that occurred years ago, they ended up having a breach where they're in violation of multiple categories, which is why they had I believe it was $16 million HIPAA violation that they had to pay. Not only that, on top of all the HIPAA violations, that resulted in a lot of other regulatory as well as civil lawsuits, including a class action lawsuit, where they ended up losing hundreds of millions of dollars as a result. HIPAA violations over the last year. So just looking at a summary of those violations, we actually have 76 total settlements. Out of those settlements, there was over $62 million paid on those settlements. So an average settlement of over $800,000. Now, the reason I point that out is this is just settlements for the HIPAA violations themselves. This doesn't include any civil penalties or any other regulatory penalties that you may be assessed. So it's really key to try to mitigate your risk, evaluate the controls, and make sure you're performing your due diligence as a leader of an organization. What are the most common violations that you see as far as those HIPAA violations that have issues? Well, snooping on healthcare records, that is one that realistically internal controls besides limiting access can't protect too much. If somebody has intent and they have access, they may be able to snoop on healthcare records. But a lot of these other elements, having internal controls to protect against them really could limit the type of exposure that you'd have. For instance, failure to perform an organization-wide risk assessment, failure to manage security risk, lack of a risk management process, failure to enter into HIPAA compliant business associated agreement. So realistically, if an organization has internal controls, and especially if they evaluate those internal controls on a regular basis, they'll be able to identify if they have any major risks in these areas where they're not meeting those requirements. So the type frequency of HIPAA HITECH attestations, as part of the process, the way it would work is you would start with a readiness assessment. So whether you're looking at a HIPAA or HITECH assessment, or you're going into a SOC 2, you always start with a readiness. Realistically, you don't want to be audited before you make sure that you know that you have the controls in place. So that's what the readiness assessment does. It really establishes the foundation to make sure that your organization is prepared, you have the controls, helps identify the controls. Next, you would actually move into the actual assessment itself, whether you're doing a SOC 2 or HIPAA HITECH. As I mentioned, guidance does suggest a minimum of 6 months, but you can realistically do it on any time frame that you prefer. We try to suggest after the first report, which a lot of times happens on a much truncated basis, simply because an organization needs it to demonstrate that they have a SOC 2 report, and then they want to move on their regular annual basis. So that's usually the objective, is to establish a time frame, and then you do it annually thereafter. You can do either a type 1 or type 2 report. Again, if you're talking about a type 1 report, you don't have to cover a certain period of time. It can be issued on a much more expedited basis. A type 2, you do have to have a period that is covered and assessed as part of the controls. So with that, let's move on to polling question number 4.
Our fourth and final polling question: which report do you find most valuable within the healthcare industry? About 30 more seconds, and this will close out our webinar.
There's no right or wrong answer. And I know we're hitting our time here. So I know there has been a few questions that come in. As part of a follow-up, I will make sure to address the questions. I know from a timing perspective, we do not have time to address them during this session, but I will follow up individually.
Great, thank you, Scott. And I'm going to close out this question, and here are the results quickly.
Two-thirds, SOC 2 and HIPAA HITECH. Sounds great. Well, everybody, we have hit our time today. Thank you so much. I appreciate you spending your lunchtime with us. Thank you very much. And again, if you do have any questions, please do feel free to reach out. I'm happy to help.
Awesome. Thank you so much, Scott. And thank you everyone for joining. A recording of this session as well as the PowerPoint slides will be emailed out to you within a couple of weeks. Thank you and have a great day.